So, hello everyone, and I'm back again with some quick revision points for NEET PG, AIMS PG, and ZIPMA PG. And this is the part one for that. So, stay tuned for the next parts also. So, I'm starting now. So, hydronephrosis may be absent on ultrasound when obstruction is associated with Staghorn calculi. This is a very important point, and recently asked this is and the most sensitive imaging modality for diagnosing ureteric stones in a patient with acute renal colic is non-contrast CT scan of the abdomen. So the most sensitive imaging modality for diagnosing in a patient is of acute renal colic is non-contrast CT scan of abdomen. Now for renal stones, diagnosis is not done by MRI. This is very important. Remember that no MRI is used for renal stone diagnosis. Now calcification is best detected by CT scan. So remember C for CT. So calcification is best detected by CT scans. Now investigation of choice for bladder calculus is CT scan. Some of them may mark MRI, but bladder calculus is CT scan investigation of choice. Now, filarial dance sign is seen with uh, ultrasonography. Also, this has been asked. And now, medullary cystic disease (MCD) can be best diagnosed by renal biopsy. 64. Most important investigation for posterior urethral valve is MCU. This is very important. Last point. Most important investigation for posterior urethral valve is MCU. Now, an important screening test for functional anorectal dysfunction is balloon expulsion test. So, screening test for functional anorectal dysfunction is balloon expulsion test. Now, next is pudendal nerve terminator motor latency (PNTML) can be best evaluated by the extent of the injury to the sphincter muscles in patients with incontinence. So, this is also important. Have been asked twice, and the most common facial abnormality in Gardner's syndrome is multiple osteomas 5-2. Then best investigation to diagnose Hirschsprung disease is rectal biopsy. This is very important. And the next one is investigation of choice for detecting minimal ascites is ultrasound. So if very less ascites fluid is there, less than 10 ml, you have to use to detect is ultrasound. Now investigation of choice for detecting minimal intraperitoneal free air is CT scan. So for detecting minimal intraperitoneal free air, CT scan is used and not ultrasound. Also now rapid sequence excretory urography is used in suspected renovascular hypertension. And now non-visualization of kidney in excretory urogram is seen in renal vein thrombosis. So rapid sequence 1 is used in excretory urography, is used in suspected renovascular hypertension, and non-visualization of kidney in excretory urogram. If the kidney is not visible, it is seen in renal vein thrombosis. And now barium solo is the investigation of choice for Zenker's diverticulum, and you must know this one. Now early gastric cancer generally indicates gastric adenocarcinoma confined to the mucosa and the submucosa. So to diagnose this that it is in early stage, we have to see that what extent it is it has spread to, so it is confined to mucosa and submucosa only. Now gold standard investigation for recurrent gastrointestinal stromal tumor is PET scan. So the gold standard is PET scan. Now the most characteristic radiological feature of small intestinal obstruction is prominent valve conniventous. The most characteristic radiological feature of small intestine obstruction. So, what can we say is prominent valvulae conniventous. Now, investigation of choice for small intestinal tumor is CT scan with contrast. So, for small intestinal obstruction, the radiological feature is prominent valvulae conniventous. And investigation of choice for small intestinal tumor is CT scan with contrast. So don't confuse in them. It is tumor and it is obstruction. And then now the next, in Crohn's disease, enteroenteric fistulas are most commonly seen. So enteroenteric fistulas are most commonly seen in Crohn's disease. This is many much asked. This question is now pneumoperitoneum can be best diagnosed by left lateral decubitus view. This is very important question. Now, double bubble sign is seen in duodenal atresia. Mucosal granularity is the earliest sign of ulcerative colitis on double contrast barium enema. So, the earliest sign for ulcerative colitis on double contrast barium enema is mucosal granularity. This is very important, and they ask this by strangling the questions many times. Like they can ask how to uh, detect the earliest sign on which investigation. So the answer will be double contrast barium enema. So you have to prepare for that. Now in teratology of Fallot, there is a core in sabot shape of heart is seen. Now direct question it is. And now snowman sign is seen in TAPVC. It is also a direct question. Egg on side appearance is seen in uncorrected TGA. Corkscrew esophagus is seen in diffuse esophageal spasm. And investigation of choice in diffuse esophageal spasm is barium examination showing tertiary contractions. So investigation of choice is diffuse esophageal spasm is barium examination showing tertiary contractions, and also in this corkscrew esophagus is seen, but the investigation of choice is different. So remember this. Now gold standard investigation for GERD is 24-hour intragastric pH monitoring. Now, curly B lines seen in mitral stenosis and lymphangitis carcinomatosa. This is very important because many of you know that mitral stenosis, but they can change the option to lymphangitis carcinomatosa also. And now, water lily sign is seen in chest X-ray of echinococcus. This is very characteristic and very important in clinical practice also. Now, popcorn calcification is characteristically seen in pulmonary hamartoma. So, popcorn calcification in pulmonary hamartoma. Spring water cyst is another name for pleuropericardial cyst. Now, spring water cyst, also known as pleuropericardial cyst. Many of them are confused in this and they get the question wrong. So, remember this. Inferior rib notching is seen in coarctation of aorta. So, very important. Now, age by which most of the normal babies show their gender is 3 years. Now, also a child is able to build blocks of 5 cubes. So, what is the development age? You have to learn the milestones thoroughly. So, development age is 18 months. If the child is of 18 months, he can build a block of 5 cubes. Now, a normally developing 10-month-old child will not be able to. What will be the 3 4 cubes? So he will not be able to build a tower of 3 to 4 cubes, because just earlier we studied that he is able to build a block of 5 cubes when the development age is 18 months. Now, varicella vaccine is live attenuated. Remember this. These are silly mistakes you can do. Now, most common age group affected by infantile colic is, so 0 to 3 months is the most common age group affected by infantile colic. And order of development of secondary sexual characters in male. So testicular development firstly, then pubic hairs, then axillary hairs, and then beard. So remember this. This is asked. And maximum growth spurt is seen in girls at the time of menarche. So maximum growth spurt at the time of menarche. Remember, pincer grafts develop by the age of it developed by the age of 9 months. Now, child changes rattle from one hand to another. Uh, at what time? So, at 6 months, rattle from one hand to another. Handedness develops at 36 months. Develops at 36 months. Now, flask shaped deformity of femur seen in Gaucher's disease. Important. Now, zebra bodies are features of Niemann-Pick disease. This is also very important. Now, vaccine-associated paralytic poliomyelitis (VAPP) associated with, now, so poliovirus type 2 associated with poliovirus type 2 VAPP. Now, seizures are maximums due to component of DPT. Which component of DPT cause maximum seizures? So, it is, the answer is pertussis. Now, dose of hepatitis B vaccine in a normal child is 10 mg. So very important. And oral TY21A vaccine given on alternate days. Remember this, on alternate days, 1, 3, and 5 days. Now, DPT is contraindicated in evolving neurological illness. If the child is suffering from neurological illness, DPT is contraindicated. Now, typhoid polysaccharide vaccine is usually administered in children above the age of 2 years. So, typhoid polysaccharide vaccine is administered at what age? It is administered at the age above than 2 years. The child of phenylketonuria mother may develop. What are the uh, abnormalities that a child can be is more prone to develop when it is a when the mother is facing phenylketonuria? So, microcephaly, mental retardation, and congenital heart diseases, these are the things that a child may develop. Now, mousy powder urine is seen in maple syrup urine disease. Now, in the deficiency of maple syrup urine disease. Now, hereditary fructose intolerance occurs due to deficiency of enzyme aldolase B. This is direct question. Now, classical galactosemia occurs due to deficiency of enzyme galactose 1 PO4 phosphate uridyl transferase. Cataract in galactosemia occurs due to accumulation of galactitol. Now, cataract occurs due to accumulation of galactitol. In Gaucher's disease, there is accumulation inside the cells. What accumulate inside in Gaucher's disease is cerebrocytes. Cerebrocytes is the component that accumulate inside the cells. Now, deficiency of enzyme in Tay-Sachs disease is hexosaminidase in Tay-Sachs disease. Now, all lysosomal storage diseases are autosomal recessive, except, this is very important question, Fabry's disease. Now, enzyme deficient in Fabry disease is alpha galactosidase. Enzyme deficient in Fabry disease is alpha galactosidase. So, thank you.